I said to you, oh darling, oh darling. See.
Good morning, everybody. Please, can we just move to one side because of the camera? Please, let's rearrange ourselves. BCC. BCC, can we have the anthems?
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians all and proud to serve our sovereign fatherland. Ibadan, continent of truth and independence sound. Soothe the spring for all who thirst, loves of knowledge to advance. Pledge to serve our cherished goals, self-reliance, unity. Love a nation there with pride, proud to build a world that is truly free. Let's unite for a noble cause. Social justice, equal chances, greatest one with honest toil. Find our people this to know, wisdom's best to set is strong. Love is shine our eyes to them, for our mind has knows. Wisdom born, thus free. Ibadan, college of medicine, hit the call. The train breaks in hands for the poor. Training, bringing up to date, knowledge for all. To God our Creator we learn to say, Aladelusi, for His praise. Bring on the glory of our noble soul. Ibadan, college of medicine, hit the call. Center of excellence, the best of all. Center of excellence, the best of all.
Thank you. Let's have our seat. Can we quickly have a seat and let's commence this noble program? I want to once again welcome on behalf of the Provost College of Medicine, everyone here present today. Please, if you know somebody who should be here and is not here, please give them a call, because if they are not here, they are not anywhere. Please call them. And I want you to turn to the person beside you. I want you to share a big gift, your smile, because that is what today is all about. Share your gift to the next person beside you. Smile to the next person beside you. Thank you. It is about oral health today. Unfortunately, the fragrance must be fragrancing. That fragrance is not fragrancy, then our panel will be telling us why that fragrance is not fragrancing, so we know what to do. The 13th Provost of College of Medicine, University of Ibadan, Professor Temitayo O. Ogundiro, I acknowledge your presence, sir. The eyes of the registrar in the College of Medicine, the deputy registrar, and the 8th secretary to the college, Mr. Aladelusi Emmanuel Odedele. He created this platform for us to fly. Thank you, sir. The financial controller, Mr. Eso Ayoshino, you are welcome, sir. The medical librarian in absentia, the Dean's Faculty of Basic Medical Sciences, who is unavoidably absent today due to another university engagement, Professor Oyeronke Odunola. Professor T.A. Lawal, our Charter Fellow of Nigeria Academy of Medicine, Dean Faculty of Clinical Sciences. Dean Faculty of Public Health in absentia, Professor M.D. Dairo. I accused Professor Kolude today that it's because it is dentistry. He came here, he said he's always punctual. Professor B. Kolude, you are welcome, sir. The Dean Faculty of Basic Clinical Sciences in absentia, Professor Taiwo R. Kotila. The Dean Faculty of Nursing, Professor Priscilla O. Adejumo. They are on their way. The faculty officers here present, the head of department here present, and our MWWIW chairman, College of Medicine Capacity Building Committee, Dr. O.S. Oga. You are welcome, sir. I have so many statements that I want to debunk today. I've always heard that the most hardest part of our body is the tooth enamel. I'm sure when they start, I'll be able to confirm whether it is true or not. We're here to discuss on oral health for self-confidence and functionality in the workplace. If our self-confidence is not there, it could be due to a lot of things. And one of which has been identified is oral health. Actually, our oral health speaks first wherever we are. Once you open that mouth, that your oral health is already speaking. On this note, I want to invite the Provost, Professor Temitayo O. Ogundiro, for his welcome address. Provost, sir.
Now that I've been given a new name, we have to decide when that christening is going to take place. And Madam Sakariya is going to be the officiating minister. Well, the secretary to the college, the deputy provost just arriving. You are welcome, sir. The deputy provost, you are most welcome. Secretary to the college, the financial controller, all our deans here present, and the chairman of the committee that organizes this program, distinguished ladies and gentlemen, both here and online. I say good morning, and I welcome you all to this year's month's edition of this program, WWW. Who will tell me the meaning of WWW? I don't want a chorus answer. It's not murmuring. Who is confident enough to tell us what WWW means? Yes? No, yes. You? Huh? Please feel free to say what you have just said. Repeat it. World Wide Web. But in the context of what we are doing today. Yes, madam. No, it's WWW. I want. So what? Yes, madam. Yes, workshop for well-informed workforce, and that is why we are here. Well, our time is fast spent. I thank all of you who are here this morning in spite of the rain. I came late, and I apologize for that. I wasn't disturbed by the rain because there was a car to bring me here. But I thought the program would start at 9. So I was in my office, and I was signing some papers, waiting for 9 o'clock. So apologies for coming late. Now, what we have this morning is not about the teeth, but it's about oral health. But you know, you cannot discuss oral health without talking about the teeth. So oral health is not just only about the teeth. It's a bigger topic than just the teeth. But the question I want to put across to you, which you will answer at the end of the discussion, is this. If somebody is born without a heart, some people are already shaking their head, that is not possible, all right? But if the person is born and the heart is dead, what do we call that? Stillbirth, right? If somebody is born without eyes, no eyes, we can all see. We can imagine how that person will go through life. If somebody is born without the 2 kidneys, all right? We can easily describe or imagine what life will be for somebody who doesn't have this or doesn't have that. But my question to you, or my poster to you, is think about it, what it will be if somebody is born without teeth. And then at the end of the discussion, we will discuss what life will be for that person. You are welcome to today's edition. Thank you.
Thank you, sir. Once a teacher, always a teacher. Thank you, sir. I acknowledge the presence of the Deputy Provost, College of Medicine, Professor Samuel B. Olale. You're welcome, sir. We are moving gradually. The next item now is the presentation from ITU, representative of ITU. And we give her a round of applause as she's descending the stairs.
Good morning, the Provost, the Deputy Provost, the College Secretary, FC, the deans, and every dignitary is available in this auditorium and online, and all distinguished members of the college. Once again, we would like to appreciate the college for the privilege given to ITU to make another presentation this morning. So this morning, we want to know how to identify official, genuine, and safe URLs. We've been talking about antivirus, spamming emails, and the like in our previous presentation. So this morning, like I said, we are looking at URLs. A lot of times, people have sent links to us where they say they are applying for maybe application, you want to apply for a job, you want to view something, and when you click on the link, you see that it takes you to another platform, or probably takes you to a place where you have to put your personal information So you want to be very sensitive. But they write something and then they embed that link inside that text. So if you look at immigration here, we have immigration.com/application. But if you overrun it, it is actually immigration.gov.ng. Looking at it, I don't know why it's not showing you, but on my system here, if we click on, okay, let me do this. So another thing we want to look at is never enter your personal information on unknown websites. So if somebody send a link to you and say, immigration is recruiting or custom is recruiting and you want to apply for that particular job, the moment you enter that platform and what you are seeing does not correlate with what you are supposed to be seeing, then you have to be conscious of entering personal information like your bank account, your name, your phone numbers, your email, and the likes. Then you also want to keep your browser and antivirus updated. We've talked about this several times, and we are still talking about it again. Always check that you have an antivirus on your system. Always check that those antivirus are up to date so that they can secure you on the web. Another thing is to stay alert. Sometimes our instincts will tell us and say, this thing you're about to click does not make sense, but we'll still go ahead and click it. So when our instinct is telling us, let us be careful of the links that we click. Then, like I said, sometimes they redirect us to another platform. You are clicking, you want to apply for something on Cowbell, and it's redirecting you to a blank, maybe Google form or something that does not even have a sign that is Cowbell that owns it. So you want to be very careful. Then when you click a link or website and you're already seeing different adverts, different pop-ups that does not even make sense to you, please kindly just log out or close it. Do not enter your personal information on these things because they are very, very sensitive. So this morning, I think we are able to be aware that when we see some links, we should be able to identify if they are genuine, if they are safe for us to put our information, and if they are the actual correct and official links that we are clicking. Thank you.
Thank you.
Just 1 minute. Tell the audience, what's the big deal about? Just click anywhere, anywhere. Why must we be sure that it's secured, that we are clicking?
It is important for us to be sure that those sites are correct because some of them ask for our personal information, and that is how they act on our phones, our banks, any other personal information, sending spam emails to us. When you click on them, they take data and personal information from your system. And if you are not careful, sometimes they use it to blackmail you, saying that you have to pay some amount of money, and sometimes you even lose that information where you don't have access to it again. Thank you.
Thank you. And I hope by now, from today, when you open your browser, that Google Chrome or Edge, those are browsers. When you open them and you click and you find any of these listed security threats, just close it immediately. And one thing that I want to acknowledge the provost and the secretary to the college and the college administration entirely is the fact that it's a beautiful thing having in-house people being the resource persons at all of these programs. For some organization, these will have been contracted out. They will look for the experts somewhere else. Can we give a round of applause to college administration? Thank you, sirs. Rubani, atin lọ sí bí kugun ètò getting there. Àgbọ̀ yóò bá yẹn. So we're getting there gradually. Ladies and gentlemen, I want you to join me in welcoming the team from our own Faculty of Dentistry, College of Medicine, University of Ibadan. They will be opening our minds on the importance of oral health. At this juncture, I want to invite Professor A.O. Adisa, who will be coordinating this section of this workshop. Professor Adisa. Professor Adisa, please have your seat in the middle. Professor Adisa has his research focused on the evolution and molecular characterization of head and neck cancers. I just hope I will not visit dentistry after this program, because all these terminologies, I hope they won't remove my teeth. He's into oral squamous cell carcinoma and salivary gland tumors, and odontogenic tumors, particularly ameloblastoma. You are welcome, Professor Adisa. Please keep a seat ready in dentistry, because all these grammars, I don't want my teeth. The presenter for today is another one of our own. She's Omonile. She's UI all through. Dr. Adeola Temitope Williams from the Department of Child Oral Health. Let's have a seat first. Dr. Amen. Professor claimed. Dr. Williams' research interest lies in dental trauma, improving oral health outcomes in vulnerable groups of children, and understanding the interplay between systemic and oral health in children. Then we have members of the panelists. We have Professor A.O. Lawal from the Department of Oral Pathology and Oral Medicine. Professor Lawal, please. We have Dr. I.O. Opeodu, Department of Perio and Community Dentistry. We have Dr. T.O. Aladelusi from the Department of Oral and Maxillofacial Surgery. May I invite Professor A.O. Adisa to take it up from this point. Professor Adisa, please. Professor Adisa.
Thank you very much, Ma, for the very warm introduction. The Provost, sir, good morning, everyone. Please permit me to just stand on the existing protocol to save time, because we have a lot of discussions this morning. And like someone said, when they saw us, they said, they are saying dentistry here today, that why don't we come for the programs? Well, I said, henceforth, we shall be coming. All right, so the way the program is structured this morning is that, first of all, Dr. Williams will give us an overview of dentistry. Most people think that dentistry is just one department, but it's actually made up of 5 departments and 7 units, each one a specialty that can stand on its own, literally. So she will give us a talk that covers practically all of the specialties, and we expect that you will have questions. The questions may not even be related to the lecture. Questions that you have had at the back of your mind that you want to ask. I've asked someone to pass out pieces of paper. I gave it out when I came. Please just jot down the question, and we'll collect it as the lecture is going on, because the panel discussion is actually going to be based on those questions. Whether you jot it down or you raise your hand and ask it at the end of the lecture is fine. So the panel will still sit on this side because we also want to look at the lecture, while Dr. T.A. Williams will connect her system and start off. Thank you very much.
I recognize the presence of the Provost, Professor T.A. Ogundiro, the Deputy Provost, the College Secretary, the Financial Controller, and the Deans of Faculties present, the Dean of Clinical Sciences, and my own Dean, Professor B.O. Kolude. Thank you for this privilege. The Chairman, Capacity Building Committee, and also distinguished ladies and gentlemen, both here physically and online. Today, I'm standing here to represent the Faculty of Dentistry, and I want to appreciate my teachers and mentors in the faculty for this privilege. Just as been said by Professor Adisa, the Faculty of Dentistry has several specialties which are being projected. We have the Department of Child Oral Health, which is divided into pediatric dentistry and orthodontics. Sorry, I think my pointer is, which is divided into pediatric dentistry and orthodontics. Likewise, we have the Department of Oral and Maxillofacial Surgery. They carry out surgeries and also do jaw reconstructions, manage children with cleft. Likewise, we have the Department of Restorative Dentistry. They have to do with restoring fractured or carious teeth. And this particular department is divided into two. We have the prosthodontics unit and also conservative dentistry. If you know anybody that has a missing tooth, that is the department to visit. Likewise, we have periodontology and community dentistry. This also has two units. Periodontology, they take care of our gums, and also when we have debts, accumulation of debts on our teeth, they are the ones that help with that. Community dentistry is the face of the faculty in the community. They go to schools, go to several places, the community, and create oral health awareness. And then we have the oral pathology and oral medicine. They are the ones that help with the diagnosis of several conditions, tumors, cancers, and then they tell us how they should be managed. So to today's presentation, oral health for self-confidence and functionality in the workplace. We are all here today, we have come to work. And looking at this picture on the screen, when we come to work, we come for different purposes. We have come all the way to carry out responsibilities that are assigned to us, for which we are being paid. And we are expected at work to function effectively. We are expected at work to be useful, and that is functionality. What is the essence of a staff that comes to work and because of toothache cannot even sign a form? Because of toothache cannot even pass a file from one desk to the other. So it's a place of interaction. We interact with our colleagues, or clients. We have people visit our offices at one point or the other. And in some cases, you have to interact with at your face and you look at mine. And for me as a dentist, and I'm sure this applies to majority of dentists, when you look at us, the first place we look at is your teeth. Or fragrance, as the moderator said, that emanates from our mouth or not. And then it's left for the other person to have his own perception. Maybe it's a fragrance or otherwise. Okay, so to oral health. Most people think oral health is just about tooth, or it's just about, I don't have pain, my tooth is not aching. It's beyond that. In fact, the WHO defines oral health as the state of the mouth, the teeth, and all other orofacial structures that enables individuals to perform essential functions, such as eating and speaking. If you can't eat because of any form of oral disease, you cannot even come to work, and you won't even be able to function effectively. And beyond this, it encompasses psychosocial dimensions, self-confidence. If there is any oral defect, either a jaw defect or a tooth is missing, I'm sure when others are smiling, somebody said something funny and others are smiling, you would want to cover your mouth a little. Do we agree with me? Or because you are not confident. Or you are talking and then somebody does like this right in front of you. What would go through your mind at that point in time? I'm sure you think, or is it that my mouth is smelling? That is the first thing that registers in your mind. So having good oral health, it encompasses being self-confident, and this also affects our well-being, and it affects your ability to socialize without pain, discomfort, and embarrassment. And all of these are needed for us to be functional at work. So a good oral health is a cornerstone for both personal well-being and for professional success as well, because it helps us to it enhances our self-confidence, and then with this we are able to function effectively. Imagine entering an office. The provost painted a scenario the other time that we should imagine being born without a tooth. Well, maybe all of us were born without teeth, but at a point in time, it is expected that your teeth should erupt. So what if no tooth erupts at the right time? I'm sure even as mothers or as parents, you would be worried. We've seen mothers that would bring their children to the clinic at 1. Maybe the child is 1. We expect that the first tooth should erupt at 6 months. And then the child, you've waited 7th month, 9th month, 10th month, first birthday is tomorrow. There is no single tooth. Definitely you would want to rush that child to the clinic and say, doctors, please, what is going on? This child has no tooth. But that may even be an extreme case. Imagine entering an office and the CEO welcomes you with this smile. What would go through your mind? Okay. All this, how about this? I would have loved to receive our comments, but there is no time. And this. And we can all imagine the kind of fragrance, in quotes, that would emanate, especially from this last picture. In order to prevent us from being victims of these scenarios, that's why we are here. And if it is already there, to motivate you to seek help. We are just across the road, and we are affordable. Okay, yes. So in addition to this, apart from oral health being boosting our self-confidence and helping us to function well at work, oral health is also linked to our general health. There are several signs of systemic diseases that can be picked up just by mere looking at the mouth. Dehydration, anemia, cyanosis, and in fact, diabetes. There are several cases of diabetes that are first picked up at the dental clinic by the time the patient presents with teeth, as in this case. And I must say that children are not exempted. In fact, it is more common in children. And I believe we are all parents here. If your child has a toothache, you will definitely take time off work, either to take her to the dental clinic or to find one solution or the other, and thus impairing our functionality at work. So what are the causes of dental caries? Frequent consumption of sugary substances is a major cause of this. Some people, while they sit at their desk working, in fact, within 2 hours, they can finish a jar of candy. Or as they are eating candy, as they finish it, they will pick on chewing gum, and then cake, and then chin-chin. Then you will soon visit us because of dental caries. Also, poor oral hygiene has been implicated as a cause of this. Not taking adequate care, not brushing very well, which we'll still look at as we proceed. But dental caries, of course, it is in phases or in stages. At the initial presentation, it may even be asymptomatic. You have no symptom at all. There is no pain. Maybe you just feel, I think there is a hole here. Or you might not even feel anything. At the most initial stage, it presents as a white spot. You just see something whitish on your tooth, just as it is here, before it progresses to become a cavity. And before the onset of pain, you could even feel that you have food packing on your tooth or in between your teeth. That could be one of the early signs of dental caries. And then it could progress to involve sensitivity, in which case you take something cold or hot, or after taking something sugary, you just feel this shock-like sensation from your teeth. It could also be a sign of dental caries. And when it has really progressed to involve the nerve, which is the pulp, then you start to feel pain. And that pain can be when there is a stimulus, or unprovoked. You are sleeping at night, you cannot sleep. Or you lie down, or you are just sitting down, you are watching TV, and then this pain begins. And when this is left untreated, there are complications that can arise. Of course, you can have swelling, which Yorubas call akokoro. I'm sure we know about this. You can have a facial swelling, and when this is also left untreated, it can progress to what we call necrotizing fasciitis. And this swelling can spread to all other facial spaces, Ludwig's angina, and then eventually it can lead to seeing people going about, and then one tooth is discolored. Have we seen that before? Yes. Just a single tooth is discolored. It's as a result of trauma to the teeth or to that particular tooth that took place a long time ago and was left untreated. They would say, the tooth is not broken now, it's not paining me, I can eat, but eventually this tooth can become abscessed. It can even lead to a cystic collection in the mouth, in which case the person would have a swelling of the jaw. Likewise, another presentation of trauma is this, in which the teeth can shift in position. And these traumatic injuries can either be due to a fall, can be due to assault, can be due to road traffic accident, or any other form of injury. Another, to the extreme, you can have the old tooth being dislodged at the time of the injury. Another common condition, and all of these that I've said will definitely impair the self-confidence of the individual. Likewise, tooth sensitivity. You take something cold, and then you feel this sharp pain or sensitivity from your teeth. It usually arises as a result of loss of the covering. The way the teeth are made, God has put the enamel as a cover to prevent insults to the sensitive part of the teeth. And once anything erodes this enamel, the sensitive part of the teeth is exposed. Likewise, I mentioned the other time that when you have accumulation of debts, they erode the bone support, and this exposes the root, and the root surface is not also as hard in that sense to the other part of the teeth, to the crown. So what are the common causes of sensitive teeth? Let me start with the thinning of the enamel, which I've mentioned. This could be due to the use of wrong toothbrush or using the wrong technique in brushing. It could also be due to exposure of the teeth to acidic substances, acidic drinks, or people who regurgitate a lot. Dental caries or dental decay can also cause recession of the gum. We can see that the gum line here, when the person smiles, then when we have accumulation of dirt, would also impair self-confidence of the individual. So what is the impact? That depending on the age, small children less than 3, they should use just a smear of toothpaste. While those that are age 3 to 6 can use something that is like a pea-sized, like granite sized. And for adults, half of your toothbrush. If your toothpaste is like half of your toothbrush, then it is okay. Then is fluoride injurious to human health? There is nothing that is not injurious to human health when used excessively. So for fluoride, there is a recommended amount, safety dose, that is already incorporated in, can cause a child to have mouth odor. Can cause a child to have mouth odor. The causes of mouth odor in children is not different from what causes it in adults. And they are not different from what we have said earlier. From tooth decay, to poor oral hygiene, to not brushing the teeth or the tongue well. Then also tonsils. Children usually can have enlarged tonsils. So if they have any inflammation in their throat, that can also cause the odor or any other extraoral cause. Thank you.
Thank you once again, Dr. Williams. I have a question here that says that you said, is referring to the fact that Dr. Williams said we should be brushing after breakfast. And I saw a lot of people reacted to that. The reason why brushing after breakfast is advised is the fact that you want to use your brushing to prevent caries. Like Dr. Williams said, caries is caused mainly by taking sweet substances, and the bacteria in the mouth feed on these substances to produce acid. The acid will dissolve your teeth, which we said is mainly calcium. But one of the factors in the production of this acid is time. There is a time factor. So if you take your breakfast in the morning, let's say you take dodo in the morning and you brush after taking breakfast, that time factor is reduced drastically. If you take dodo in the morning and you don't brush after, you brush before breakfast and you took dodo is sticky. It is on the tooth for a long time. The bacteria in your mouth will have time to feed on the sucrose in dodo to produce acid until you brush at night. So the advice is that you brush at night and you brush after breakfast. That is the best, even though people find a middle point about it. So that there is a science behind it. It was not just suggested, it's a science. And the science is that you want to reduce the factor of time in the multiple production of acids that dissolves the tooth. Then the second question here is that, why does the mouth have odor when we fast? So when you are fasting, several things happen that can cause mouth odor. Number one, food itself cleanses the mouth, even though it's a little cleansing. There is a little cleansing that you have from eating. When you take your food, it cleanses some debris away from your mouth. So if you have not eaten for a long time, that cleansing effect of food is removed. That's number one. Number two, water also cleanses the mouth. If you have not drank water for some time, that cleansing effect is removed. Then the third factor is water. When you are fasting for a long time, you are not taking water, you become dehydrated. The saliva in our mouth, a major composition of saliva is water. And when you are not taking water, you are dehydrated, the saliva production is reduced. And when saliva production is reduced, one of the functions of saliva is that it produces some antibodies like IgA that can attack bacteria that causes bad breath. So when saliva is reduced, when you are dehydrated, saliva is reduced, so this bacterial activity can increase. That's the third one when you are fasting. And the last one is that when you are fasted for a long time, what happens is that you are deprived of glucose for a long time, and the body needs energy. So what the body will do is to mobilize fat in your body, the stuff fat in your body to produce energy. However, when it's doing that, one of the things that it produces is what we call ketone. And when you ketone is broken down, when you breathe out, that's what we call ketotic breath, just like what diabetic people have. So truly, fasting, particularly long fast, can cause bad breath. What we advise people is that when you are fasting, even though you don't want to take water, you don't want to take food, you can rinse your mouth regularly. Just switch and rinse out just to improve your breath and your confidence. Thank you.
Good morning, sir. Good morning, everyone. So my question here, should wisdom tooth that does not fully erupt be removed, or can it be managed? Plastic removal of third molar advice
quickly, because of the sake of our time. Does eating bones strengthen the teeth? Well, eating bones has two effects. One, it can allow you to exercise your jaw. The reason why people are having more impacted teeth these days is because of the lack of jaw exercise. Over centuries, our diet has changed from being very hard to becoming moderate or soft. So our jaw size doesn't become as large as it used to be. This has been found out by anthropological studies. And so the teeth are the same number, so they get stuck in between and they can't come out properly. So eating substances that are hard may help with jaw exercise. However, eating bones does not necessarily make the teeth stronger. Bones have calcium. You can have other sources of calcium that can make your teeth strong. And of course, eating diet that is extremely hard can also damage teeth. Just like we saw in the presentation, they can cause fractures. It can cause pain at your joint that is in front of your ear. When you open your mouth and close it, you feel a joint moving there. Many people present as they grow older with serious pain around we call it the temporomandibular joint. And so eating all those hard diets can actually cause that pain to start. Does unripe fruit, which is acidic, affect? Definitely yes. Any type of acidic substance. That is why it's not very welcome to squeeze orange directly and use your teeth to be squeezing it. You squeeze it in the cup and drink. And you space it out. Anything that is acidic, used consistently over time, can cause tooth wear. Just let me hold that. Now, for individuals that spit while okay, then there's no problem. Like we have seen in the lecture, anything that is done overly will cause a problem. Even toothbrushing, if you do it with the wrong technique and excessively, it will cause tooth wear. Now, as a water pick, it's a device that looks like a phone. It's a device that looks like a phone and has a nozzle. And if you place it correctly, can flush out any debris in between your teeth. So yes, water flossing is very effective. Now, what is your take on Enyimeka and grills? Well, Enyimeka name is essentially a kind of crown. And in dentistry, we have conditions that we treat by crowning the teeth. So it's for those that need to get it, there's no problem. So that crown over your tooth, they have to first nothing wrong with that. Then our tongue scrapers, good for use, good, but do not use excessively. And then they try to wash and brush excessively and use tongue scrapers. The danger, you scrape the tongue and cause damage. You scrape the tongue and cause damage. There's trauma, there's inflammation. You may not feel it, need to do tongue scraping. Then all our teeth on the roof.
So when it's time to translate into brushing, it is not difficult. But even when it wasn't done and it's difficult, there are playful techniques that you can use. We don't encourage that you struggle with the child, because you can, in that attempt, injure the child. Let the child do whatever brushing he wants to do by himself. And then when you are done, you just playfully tickle the child. There's still something here, there's still something here. And then you can now collect the brush and do the remaining cleaning. Thank you.
Thank you so much.
I think we can do better. They did a wonderful job. For time, I know most of us will have preferred we'll continue, but dentistry will still come again. At this juncture, I want to invite the Provost, College of Medicine, Professor Temi Dayo, this time around, for his closing remark.
Thank you very much. Our time is fast spent, and I want us to leave here as soon as possible. So I'm not going to be making any closing remarks other than to appreciate our team from dentistry for their time and for the comprehensive package that they have given us today. I believe that we are all
and the entire management of the College of Medicine. I want to express very deep appreciation to the Dean of the Faculty of Dentistry and all members of the panel. It's been a very, very enlightening session. And I believe, personally, I have learned a lot. You know, and there are some things I will begin to give proper attention to. And I believe the same applies to all of us here present. So once again, we want to say a very big thank you to you. And of course, we expect to see more of you at our subsequent sessions. I also want to appreciate the financial controller, the chairman, College Capacity Development Committee, who is coming here for the first time in that capacity, Dr. Oga. You're welcome. Thank you. Though not absent, but present online, the director of BCC, Dr. Yinka Ibuhari. We appreciate the excellent work you're doing. And of course, for all of us here present, we are here because we want to build our capacity and ensure that we can discharge our functions confidently. So we want to appreciate us for coming, and we want to challenge us to ensure to be punctual as subsequent training sessions like this and encourage others to come. So on that note, we say enjoy the rest of the day, have a lovely weekend, and remain productive. Thank you very much.
ITU, please let's have the anthems in the reverse order. Thank you.
So
panels, please, group photograph. BCC, pictures.
'Cause you make me happy all day long. Even when I'm angry, I'm still singing a song. 'Cause you make me happy all day long. And I wait for you as you learn me a new carol. Sings carol. Your shoulder is the best beloved to me, you know. And I know